Your tongue is not just for tasting food. It's actually one of the most underrated diagnostic tools in medicine. For thousands of years, physicians from ancient China, Greece, and India all agreed. Before you treat the patient, look at the tongue. And today, modern science is proving them right. Your tongue changes color, texture, and shape in response to what's happening deep inside your body. In fact, many serious conditions, from vitamin deficiencies to autoimmune diseases, leave their first visible clue right on the surface of your tongue. First, you need to know what a healthy tongue looks like. A normal, healthy tongue is light pink, not bright red, not white, not purple. It should be moist, not dry or cracked, and it should have a thin, whitish coating that's almost translucent. You should also see tiny bumps across the surface. Those are called papillae, and they contain your taste buds. If this is what you see, congratulations. But if not, here are the warning signs. Warning sign number 1, a pale tongue. If your tongue looks washed out, almost white instead of pink, this is often a sign of anemia. Anemia means your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. The most common cause is iron deficiency, but it can also be from low vitamin B12 or folic acid. You might feel tired, dizzy, or short of breath. If your tongue looks bleached, a simple blood test can tell you what's missing. Warning sign number 2, a bright red tongue. Sometimes called strawberry tongue because the bumps swell up and make it look like the surface of a strawberry, this is not normal. In children, a bright red tongue with a fever is a classic sign of scarlet fever, which comes from untreated strep throat. That requires antibiotics. In adults, a bright red tongue often points to a vitamin deficiency, specifically B12 or folate. But there's a more serious possibility. A red, smooth, glossy tongue can also indicate pellagra, which is a deficiency of niacin. Or it can be a sign of celiac disease, where your body can't absorb nutrients properly. Either way, red means inflammation. Your body is trying to tell you something is on fire. Warning sign number 3, a purple or bluish tongue. This one is serious. It means your blood is not carrying enough oxygen. This is called cyanosis. It can happen in people with chronic lung diseases like COPD or asthma. It can also happen in advanced heart failure or congenital heart defects. In some cases, a purplish tongue can point to a blood clotting disorder or even carbon monoxide poisoning. If you notice a persistent bluish tint to your tongue, especially if you're also short of breath or have chest pain, do not wait. Seek medical attention immediately. Warning sign number 4, a yellow tongue. Before you panic, check if you just ate turmeric, curry, or something with yellow dye. Those can stain your tongue temporarily, but if the yellow color stays, it could mean trouble with your liver or gallbladder. When bilirubin builds up in your blood because your liver isn't processing it properly, that yellow pigment can show up on your tongue. That's jaundice. However, a yellow coating is more commonly caused by poor oral hygiene, heavy smoking, or an overgrowth of bacteria or yeast. In traditional Chinese medicine, a yellow coating is a classic sign of what they call damp heat in the digestive system, often linked to gastritis or gallbladder issues. So if your tongue is yellow and you feel nauseous or have abdominal pain, get your liver checked. Warning sign number 5, a black hairy tongue. This looks terrifying, but it's actually one of the least dangerous conditions on this list. Black hairy tongue happens when the tiny bumps on your tongue, the papillae, grow longer instead of wearing down normally. Those long bumps trap bacteria, yeast, and food debris, and they can turn black, brown, or yellow. It looks like hair, but it's not actually hair. What causes it? Poor oral hygiene, heavy tobacco use, drinking too much coffee or tea, or taking certain antibiotics. It's not dangerous, but it's ugly, and it can cause bad breath. The fix is simple. Brush your tongue daily, stay hydrated, and cut back on the coffee and cigarettes. Warning sign number 6, a smooth, glossy tongue. Remember those papillae we talked about? When they disappear, your tongue becomes smooth, shiny, and often tender. This condition is called atrophic glossitis. It is a classic sign of a nutritional deficiency, most commonly iron, vitamin B12, or folate. But it can also show up in autoimmune conditions like Sjogren's syndrome, which causes dry mouth, or as a side effect of certain medications. If your tongue looks like polished glass, you need a nutritional workup. Don't just ignore it. Warning sign number 7, a cracked or fissured tongue. Some people are born with deep grooves in their tongue. That's usually harmless and runs in families. But if new cracks suddenly appear, especially if they're accompanied by burning or redness, it can be linked to psoriasis, Down syndrome, or Sjogren's syndrome. More commonly, those deep grooves trap food and bacteria, leading to bad breath or fungal infections. The solution is regular tongue scraping. But if the cracks show up with other symptoms like joint pain or dry eyes, mention it to your doctor. Warning sign number 8, a scalloped tongue. Look at the edges of your tongue. Are they wavy or indented like the edge of a pie crust? That's called a scalloped tongue. It happens when your tongue is too big for your mouth and presses against your teeth. Why is your tongue too big? One common cause is dehydration. Another is sleep apnea, where your tongue relaxes and swells slightly during sleep. But the most common cause in traditional Chinese medicine is something called qi deficiency, essentially low energy in your digestive system. More practically, a scalloped tongue can also be a sign of hypothyroidism, where your thyroid gland is underactive and everything in your body, including your tongue, becomes slightly swollen. If your tongue has teeth marks on the sides and you're also gaining weight or feeling cold all the time, get your thyroid checked. Warning sign number 9, a painful or burning tongue with no visible change. If your tongue hurts or burns but looks completely normal, it could be something called burning mouth syndrome. This is a chronic pain condition that affects millions of people, especially women after menopause. But before you assume it's burning mouth syndrome, rule out the obvious causes. Acid reflux can burn your tongue. So can overusing mouthwash. So can extreme stress. And in some cases, a burning tongue is actually an allergic reaction to toothpaste, mouthwash, or even a dental filling. A burning tongue can also be the first sign of diabetes. High blood sugar leads to dry mouth, which leads to a yeast infection called oral thrush, which burns. Warning sign number 10, a white coating that won't scrape off. A thin white coating is normal. A thick white coating that you can scrape off is usually just bacteria or dead cells. But a white coating that stays put even after you scrape it, that's different. If you have white patches that look like cottage cheese and they bleed when you try to remove them, that could be oral thrush, which is a yeast infection common after antibiotics or in people with weakened immune systems. But there's a more serious possibility. Leukoplakia causes thick white patches that cannot be scraped off. These patches are usually harmless, but in a small percentage of people, they turn into oral cancer. If you smoke or chew tobacco, your risk is much higher. Any white patch that lasts more than 2 weeks needs to be looked at by a dentist or doctor. So what should you actually do with all this information? First, don't diagnose yourself. Your tongue is a clue, not a verdict. Many conditions can look the same on the tongue. A pale tongue could be anemia, but it could also just be poor circulation from cold weather. A yellow tongue could be liver disease, but it could also be last night's curry. The key is persistence. If your tongue looks wrong for more than 2 weeks and you have other symptoms like fatigue, pain, or weight changes, see a doctor. But if you want to keep your tongue healthy in general, here's what works. Brush your tongue every day. Use a tongue scraper. Drink enough water. Stop smoking. And eat a diet with enough iron, B12, and folate. Your tongue is talking to you every single day. The question is, are you listening?